Hello class, today we're going to talk about ambulation and ambulatory aids. Our objectives are to identify the phases of the gait cycle and components of stance and swing phase, identify determinants of the gait pattern, identify range of motion changes during the gait cycle, explain muscle activity involved in ambulation, we'll describe the mechanical difference in walking and running, we'll discuss types of gait with assistive devices, and lastly, we'll explain techniques for safe stair ambulation with assistive device. So looking at our gait cycle, we're broken down into two phases. We have the stance phase, which is the foot that's on the ground, and the swing phase, which is the foot that is coming through and is not touching the ground. Stance phase is 60% of the gait cycle. The swing phase is 40% of the cycle. So you see, starting there on the left, our stance phase begins with heel strike. So our foot is dorsiflexed. Our heel strikes the ground. Then we progress to foot flat. So we see in that we go from being very dorsiflexed to a bit dorsiflexed. And so our anterior tibialis eccentrically controls the foot going down to the ground. So some people have a foot slap from a neurological condition, and you can actually hear them walking across the room because every time that the heel strikes, you'll hear the foot then slap down on the ground because they don't have that eccentric control of the anterior tibialis. Then we advance from foot flat to mid stance. Now our center of gravity is over our foot, and now again our foot is having to dorsiflex as we come over the top of our foot. And then from mid stance we go to push off. So at push off, you see how the ankle is dorsiflexed, and now the gastrocnemius is pushing us forward. So now let's talk about swing phase. So we move to the right side of the screen. So the swing phase is the other 40% of the gait cycle. And so now this is where the foot has left the ground. So you can see there at the acceleration phase where the toes are no longer touching. So at push off, they're touching the ground. As soon as they leave the ground, you're now into the acceleration phase. And so you see that the ankle is plantar flexed, but now it's mid swing. Now the foot is dorsiflexed again. And you have to have that for clearance, because if your foot maintains that plantar flexed position, you're going to drag your toe on the ground and you're going to stumble and fall forward. And then you go from mid-swing to deceleration, and you see at the end of deceleration, the foot still has not touched the ground. As soon as it touches the ground, you're now into heel strike. So again, you see the foot is in a dorsiflex position, getting ready to touch the ground. So the gait cycle is basically a controlled fall. So you're carrying your momentum forward, and you are getting your foot out in front of you before you fall down. And then that foot propels you into your next step. So it is basically a controlled fall. So some three terms for you here: stride length, step length, and stride width. So stride length, it goes from heel strike to heel strike on the same foot. So the back of the heel to the back of the heel on the next step. Whereas the step length is just the distance from the heel strike of one foot to heel strike of the opposite foot. So that's just one single stride. And then, or one single step. One stride is going from the one foot to the one foot. And then the stride width is the midline distance of one foot compared to the other. So you have some variability on these depending on the individual. Depending on the height of an individual. Obviously someone with longer legs are going to have a longer stride length. Some people have a more narrow stride width. Some people have a bit more of a widened stride width. So we have a lot of variability with those. One thing that distinguishes between walking and running is that you have double limb support. So you see in this picture of this person walking on the treadmill how her left foot is struck down, so she is in heel strike on that foot, and now she is still at toe off on her right foot. So she is still touching the ground with both feet. So it's the beginning of stance in one and at the end of stance in the other. So this is about 25% of the gait cycle. So if you've ever seen speed walking, this is one thing that they have to maintain. They have to have both feet on the ground at the same time. Otherwise, they are running. So we have determinants of gait that allows us to be energy efficient. So walking is a highly efficient activity. So I'd have patients all the time. I would ask them if they've been doing their exercises to strengthen whatever body part they were dealing with. And they say, well, I've been walking a lot, so that's got to count for something. Well, no, not really, because we don't use a lot of muscle to walk, and we're very efficient in walking. Realize for most of the history of mankind, walking has been the primary mode of transportation. So if you're just wearing yourself out, just getting from point A to point B because your walking is so inefficient, then one, you're going to demand greater amounts of energy supply, so you have to eat more. So for the bulk of our existence throughout history, mankind doesn't have the kind of food resources that we have in our country today, so it had to be very efficient. Otherwise, the demands on our system would be greater. We would require more energy coming in just to get around. So gait is very efficient. Our body center of gravity moves both horizontally and vertically during ambulation to help make this more efficient. So number one, our pelvic rotates on a vertical axis. So again, going back to the speed walkers, you wonder why their pelvis moves so much. So that pelvic rotation increases your step length. So you're able to walk farther with fewer steps, which is more efficient. You also have a pelvic tilt in a frontal plane, so that allows a little bit of shift there to allow one foot to go into stance and then the other side to be able to swing through, so you have that natural tilt so you don't have to pick up one side to be able to clear the leg through. And then we have knee flexion and stance face. This allows us to absorb shock and absorb energy as we walk. And then our ankle motion is lowest in mid stance. So again, that lowers us down just a bit. And then we have some lateral pelvic displacement. Again, allows the opposite leg to swing through. So our range of motion during gait cycle, as I was saying, is very efficient, so we don't use a lot of motion to walk. So our trunk stays pretty much erect and in a neutral position. Our trunk moves opposite of the pelvis. So as our pelvis goes one direction, our trunk again stabilizes and helps to maintain our center of gravity over our base of support. So our pelvis moves in all three planes, approximately 4 degrees in the sagittal plane, and then only 8 degrees in the transverse and frontal planes. Again, this does not sound like very much. So again, if you've ever done speed walking, you know that it creates a lot of greater expenditure of energy, and you're much more tired from it because they're moving a lot more than just 8 degrees in the transverse plane, so that it increases their step length a lot more. And you may have been on crutches at some point in your life, and where you have to use your upper extremity to walk, going back to the energy conservation thing. You know, crutches, you get tired, you get wore out. I feel bad for our athletes just going across campus on crutches because it will wear you out because you've lost that energy efficiency. So then back to our range of motion, our hip only moves about 30 degrees of flexion at heel strike and only 10 degrees at the extension at heel off. So only 40 degrees of excursion at our hip. And again, 30 degrees isn't a whole lot. 10 definitely isn't. And then 60 degrees at our knee in swing phase, and 0 at heel strike. And again, in a loading phase at mid stance, we're absorbing energy, so it's able to eccentrically control that through flexing at the knee at about 15 degrees. And then the ankle, we only have about 30 degrees of excursion there. We have 10 degrees at dorsiflexion and mid stance, and only 20 degrees at toe off. So again, not a lot of range of motion. Our muscle activity, again, I said that walking doesn't require a lot of muscle activation. Mainly occurs during the beginning and end of stance phase, and very little activity is going through mid stance, and definitely not through the swing phase. Swing phase is mainly going on the momentum that we've created during the stance phase to propel us forward. So this is really important for you to understand. Our muscles do 4 things. They're either going to accelerate, decelerate, absorb shock, or they're going to stabilize. So for the accelerators, the gastrocnemius acts as an accelerator at the end of stance phase. Remember back to the picture I showed you a second ago, how the heel is coming up, the gastroc is firing, it's propelling you forward. The hamstrings work at the beginning of stance phase. Again, they're propelling the body forward, bringing the body forward as it extends the hip. Then the decelerators, the hamstrings then work to decelerate in swing phase. So they accelerate in stance at the beginning, they decelerate in swing. And then I already talked about the anterior tibialis controlling the foot from heel strike into stance. And if you don't have that eccentric control, then you have a foot slap. Shock absorption, the first 15% of stance, the quadriceps is the big shock absorber. And especially with running, if you ever try running on a treadmill with your knees bent, you will see real quick that how much the quadriceps do. Also realize that we get a lot of shock in our body, especially with running. Just normal walking, you put more than 100% of your body weight through your joints. So it's a lot of shock that you have to absorb as your foot hits the ground. And with running, depending on how fast you're going, it can be up to 700% of the body weight. And then important stabilizers, the gluteus max stabilizes the trunk and the sagittal plane, which prevents forward trunk lean. And then real important in the frontal plane, the hip abductors do a great job of maintaining that stability so that you maintain hip, knee, and foot alignment. If your hip abductors are weak, as if you'll watch these videos, you'll see hip weakness, and you'll see how the pelvis really drops out to the side, and it really changes the angle at the knee. So a lot of times runners will have some knee issues that are coming from weak hip. So some differences between running and walking. We have a shortened stance phase with running. So again, stance phase with walking is about 60%. It's only 20 to 30% with running, depending on how fast you're running. You have a lengthened swing phase. So again, if your stance phase is 20%, your swing phase has got to be 80%. If your stance phase is 60%, then your swing phase with walking is going to be 40%. You have no double limb support, as I talked about earlier. Instead, you have a double float where neither limb is touching. So this occurs at early and terminal swing phase, and you'll see here in a minute, I'll show you some pictures, and you'll see the person is completely off the ground. Depending on the speed, you may not have a heel strike. Instead, they'll call it a foot strike. So you'll have some runners that do heel strike, other runners just strike with the forefoot. So you have greater hip and knee flexion and swing phase with running, and the hip does not fully extend in stance phase. And then you got a whole lot more knee flexion in stance phase. You have 35 degrees instead of the 15 with walking. And then you have much more plantar flexion. So remember, you had 20 degrees at toe off with walking. You have 60 to 75 with running. So you'll have trunk lean, may only be 4 to 7%. But if you're sprinting, it's going to be up to 20, not percent, 4 to 7 degrees, up to 12 degrees with sprinting. So you got that lean, your momentum's going forward, and so you have that trunk lean instead of being upright and neutral with walking. So you have high demands on the quads at the foot strike and most of stance. The foot strike occurs under the hips and not out in front of the body. And then you have greater extension, hip extension in a fast walk than you do with a slow run. So if you look at these guys in the picture here, not sure if that's a sunrise or a sunset. I'm going to pretend like it's a sunset because I don't know why anybody would run that early in the morning. But anyway, the first guy on the far left, you see the hip and knee flexion. Remember, you only have 30 degrees of hip flexion with walking, and he's probably at least 60 there. Looking at his knee, we only have 60 degrees of knee flexion with walking. He's at well past 90, probably around 120. And then he kind of has more of an upright run. The next guy, you see how his back leg looks like it's way behind him, so it looks like he's got a lot of hip extension, But if you take the knee out and you just measure and the angle at the hip and the trunk, you see he's got a little trunk lean there, so he's pretty much at neutral hip extension there. So you see the third guy from the left, now he's getting ready to go in stance, and his foot's just a little bit out in front of him, but not much. By the time he's really hitting the ground, then that foot's going to be right underneath his pelvis. And again, you see his back leg, it looks like it's way behind him, but you see all the knee flexion that's occurring there. The next guy, again, you see the hip and knee flexion in the swing leg on his left, how his foot's almost up to his butt, so he's probably got about 140 degrees of knee flexion there. The next guy, look at the plantar flexion that he has at his foot, how he's really extended and plantar flexed. Remember, you only have about 20 degrees of plantar flexion with normal walking. You know, he's probably 60 to 70 there. And again, it looks like he's got a lot of hip extension, but with the forward lean that he has, you can see if you take out of the picture the lower leg that he's pretty much in neutral, maybe a little bit extended there. The next to the last guy, you see how his foot is pretty much at strike phase, and he's almost right underneath his pelvis. And then again, that last guy, you see all that ankle plantar flexion that he has. So let's switch gears to ambulation with assistive devices. So the assistive device, the goal is to increase stability, to decrease or eliminate weight bearing. It's used if the athlete or patient has an antalgic gait pattern, if they cannot walk normally. It's to prevent stress associated with abnormal gait. So our goal with using an assistive device is for them to walk as normal as possible. And then lastly, we want to prevent further injury. So let's say post-operatively, if somebody has some screws in their ankle, we don't want to start bending and breaking those screws off. And then you're familiar with crutches and canes and walkers. Some of you have probably seen the little scooter that's up on the far upper right. We actually have one of those now that's been donated by our good doctor. So you're pretty familiar with crutch fitting. Not going to go too much over that. Make sure that it's not up in their armpit, and we want to bend at their elbow. We want the tips of the crutches 6 inches forward, 6 inches laterally. And crutches are used for agile and healthy patients, so we usually didn't give those to geriatric patients. You know, they're in their 70s or 80s following a hip surgery or something like that. The cane fitting, you want to use in the contralateral hand. You want it to be at the level of the greater trochanter, and we just basically use this for a balance assist. You're not going to take weight off using a cane. And then a walker, the same height as a cane at the greater trochanter. You can use a forearm support that was shown in the picture if you have an upper extremity injury. Some people in car accidents, you know, will have a lower extremity and an upper extremity injury as well. So crutches, you can have a 4-point gait pattern. This is used with partial weight bearing. The crutches move forward. The involved extremity moves in between the crutches. You can have a 3-point gait pattern. This is with a non-weight bearing individual. You can swing 2, where your involved lower extremity goes to the point that's even with the crutches. You can have a swing through, where it goes past the crutches. And make sure the weight's placed into the rib cage and not to the axilla. Single crutch gives you a little bit more stability than a cane will. But again, it's only used for stability, not with non-weight bearing. So you're not going to take a lot of weight bearing off just using one crutch. And again, it's on the contralateral side. Assistive devices on stairs, use the rail if you can. Remember that heaven and hell principle, good go up, the bad go down. I used to work with a guy in Alabama that always said the good go up to heaven, the bad go down to Auburn. So the uninvolved leg, it goes up first. The involved leg advances down first. And then the assistive device always goes with the involved leg. And that's our lecture for today. I hope you enjoyed it. We'll have a great lab.